welcome. We're glad you're joining us today. I'm Dave Kless. I serve as the Director of U.S. Operations for Heartline. On the screen also is Elose Ambeau. Elose is the clinic administrator for the Heartline Maternity Center. And so she's joining us today for the first in a series of interviews that we're going to hold with folks that are on the ground doing the work every day with Heartline, and that we're so proud to be able to work alongside and with. And so I'm honored to spend some time with you today, Elose. It's always great to see you, and thank you for making time. We appreciate it.
Thanks for having me.
Last time we heard from you, or last time we shared some stories about you, it was earlier in 2021. You had a baby on the way, and were joining us at the Heartline Maternity Center in a probably a part-time role at that point, I would guess. And since then, you've become the clinic administrator in a full-time capacity, I would assume.
Yes.
And so it's good to have you back. I'm going to post links not only to our blog post where we featured Elose back in, I want to say it was March for International Women's Day, but we also shared an email, April, maybe? When was Elose Joy born?
It was in March. Well, my baby was born in March.
Okay.
So there was an email, I think maybe, yeah.
Right at the end of March, yeah? Yeah. And so we also introduced Elose Joy back at the end of March, early April there. And so you may already be familiar with Elose, but if you have not, you get to meet her today, and what a privilege. We're so grateful to have you. Thank you for making time for us.
Yeah, thank you.
I guess to start off, we know that, you know, not really just the past year, obviously in the past probably 2 or 3 years, we've seen a lot of turbulence in Haiti. You've had some incredible highs, obviously, in the birth of Elose Joy and the work being done at the maternity center. But how really have you been? How has your family been? Tell us a little bit about that.
We're doing great. It's been good. I mean, like having a 10-month-old, she'll be 11 months old in a couple of days, in what, let me see, 8 days, the 15th. As it has been a ride. I mean, like, it's being a new parent and new job, and it's just like has been a lot, especially with the way Haiti has been. It's all have been a crazy few years. So it's like there are days that are amazing, and there are days that it's just frustrating, and there are days that's just like, can I keep going another day like this? But it's been great. I enjoy being a mom, and Elose is a bundle of joy. She's so active. Like she hasn't walked yet, but she crawls, she cruises, she climbs on stuff. Anything that she's able to climb up, she does. So it's been great. It's been good.
We talk about coming on as the clinic administrator. What kind of responsibilities have you added in that role? What kind of things are you accountable to?
So I work Monday through Friday, meaning like I still work weekends if I'm here. Right. So 9 to 5. And I help kind of like run the place here. We have our big days, Tuesdays and Thursdays are like really big for us here. Tuesdays when we have our postpartum moms, and Thursdays when we have all our pregnant moms come. And we have clinic, we do a lot of stuff. So I assign patients to each midwives. And also I help connect like anything that needs to be fixed, anything that needs to be done. I connect Sylvester with, like, I call Sylvester instead of like 3 different midwives or 3 different people calling him about one thing. Right. So they tell me and I tell him. And I also talk to KJ, and like anything that I don't know, have a question about medically, I message her and she'll get back to us. And I talk to Tara too about staff stuff and other stuff, anything that needs around here. I talk to them, and Troy also. So it's just like I'm kind of like here connecting with our other people that are here in Haiti and also in the States.
Now we know from the post earlier in the year, early last year, that you're an RN. You were trained in Kentucky. Is it Kentucky Christian University?
Yes, Kentucky KCU, Kentucky Christian University, Grayson, Kentucky.
There you go. And then you had done some work in labor and delivery in Kentucky.
Yes, yes. In Moorhead, it's St. Clair.
Okay.
St. Clair Regional Medical Center.
Very cool. And so now you get back to Haiti, and you're an RN among a sea of midwives, right? I mean, there are other RNs at the MC, but less than the midwives. Yeah. So how does your RN degree play into that?
So I'll say my RN degree really helps with having the knowledge and also having worked in labor and delivery. So all that knowledge, I can really apply it here. And also in the years back before I moved to the States, I worked as an office manager. So that part kind of really helps me move into this clinic administrative running things. So it's just like being the RN here with the midwives. They've had a lot of experience of hands-on when they start. I think their program is about 18 months where they deliver. They have a lot of babies that they need to deliver. While I, on the other hand, we did a lot of studying of everything. And then when I graduate, I centered myself towards labor and delivery. Nice. And because that's what I've always wanted. So in the States, I did a lot of laboring and administer medication and stuff in the States, but I never had the role of delivering a baby. So if she's complete, I call the doctor, she called the midwives, they come and deliver the baby. It was never my world. So coming here, I do have a lot of knowledge, but at the same time, I'm also learning from these midwives of being confident to deliver a baby. It's just like, I've seen it, but that's never has been like what I do. So there are days I'm like, should I be doing that? Because of the mindset, like in the States, I have to call the doctor, I have to call the midwife to come and do the delivery. So working with them has really helped boost up my confidence when it comes to delivery, and also just bringing what I have and sharing with them too. So it's been great.
What about Haiti right now? And by right now, the last 12 to 24 months, maybe even 36 months with Paylock. Yeah. How do you think, what kind of effects, I guess, in your experience and knowledge is that having on moms and what you're seeing in families as it relates to clients at the maternity center?
I would say like it's hard right now in Haiti. It's hard with the way things have been, and especially not only with the way the country is, and also with the kidnapping and stuff going on. It's still a lot of stress for moms. So it's just like you're pregnant. Some of them, it's their very first baby. They're excited about their baby. They're happy and like planning for it. But in the back of their mind, there's still that stress of like, what if the Paylock happened? Will I be able to get transportation? Like we had a mom a couple of weeks back who it was false labor. Like she came in, but she was like, I'm afraid of staying at home and then things get really serious and I can't find a car to come here. So that's that constant worry in the back of their mind it's just hard. And these moms, they are really resilient. They work hard, they fight for their family, they fight for their babies. And that's why some of them will do the sacrifice of walking miles, walking to an hour and a half to get here so they don't miss out on the program. Because if they're late, they're out. If they miss a day, they're out of the program. We have to be strict about it because we want to provide good health care. And we meet every Thursday, and we don't want a mom to miss out and then something happens. Like last week, we had a mom who delivered at 34 weeks and 4 days, but she came here. She wasn't feeling well, but her blood pressure was already high. And we switched her medication. And that after we switched her medication, blood pressure went down, and then it went up through the roof, 180 over 120. So we had to transfer her to higher care. We give her medication, get her somewhat stable to get her to another hospital. When we got her there, got her all the medication that she needs so she can have a C-section. So it's because of stuff like that that we have to be strict about our program, about you have to be here. So we talk to them about it. Like, here's why we want you to be here every day. Sometimes you might be at home and you say, you have a headache. I don't want to show up. A headache your blood pressure could be up. Other symptoms might be accompanying with your pre-E. So we want you to be here just to make sure if something happens, we need to take you to higher care. And I did actually talk to that mom. I was like, you really care for yourself because you listened to us when we told you we want to watch you for the night and change your medication because your blood pressure isn't under control. And she said, yes, if I had gone home, I seriously don't think I would be alive or my baby would be alive, because we really want to decrease the maternal death and the infant death in Haiti. We do have a limited capacity that we could do that, but even if it's 1%, it's change.
Right.
So that's stuff like that we do. And they're really dedicated to coming here, really dedicated to, if we say you have to do this exercise, the moms are really, they will do it just because they want a great birth and want to live and want their baby to live.
Yeah.
We have a lot of, since the way the country has gone crazy, we've seen a lot of our mom early on in pregnancy, they have increased blood pressure and a lot of pre-E that we have to transport. So it's just like all that stress, I feel like some of it might just be like normal for them that it just happened. There's no way stress or not that could prevent that. But we've had more transport in the last year, especially last year, than we've had before with all the stress that has been going on. So I do believe like the country the way things have been played a big factor in how increased blood pressure and all of this stuff has been happening and us having to transport patients to PIH. We've had another patient, she was complete. We had to transport her. She couldn't push effectively, got her to the other hospital, and she ended up with their C-section. They had to resuscitate her baby. Even though everything was okay for some, we don't know what happened, but her baby's great. But when she came back to us, because after they're done at the other hospital, they're discharged, they get to come back and be with us for a couple of days. So we can make sure their baby's latching on well, everything is okay. If they had a C-section, they're healing well, and making sure their bonding is great. And she was talking to me, she was like, Miss Elose, it's just like, I feel like so, I don't know. I love it. Like, all I heard is just like, we're being transported and their ambulance was ready, a driver was ready. All I had to do is get in there. I didn't even have to do anything. I didn't have to worry about finding money but it's just like, she was so happy. She was like, it's just like this. And then things just keep rolling. And you guys got me there, got me admitted and everything. It was like, it was amazing. I love it.
I love it.
Stuff like that kind of makes us really happy.
What happens in a community where there is no Heartline Maternity Center? What happens to that mom with preeclampsia? Do those moms attempt to birth at home? I mean, what happens if Heartline isn't there?
So if they're close, like they live in the city, like they live in Port-au-Prince, in bigger cities, they tend to go to the hospital to deliver. If they live kind of like mostly out in the country, they try to attempt delivering at home. And when things get complicated, then they get transported, they find a car, pay somebody to take them to a hospital. It's not like they can call 911 or call an ambulance to come pick them up. No, that's not available. Even in Port-au-Prince, you can't really even call an ambulance to come pick you up. A lot of moms end up dying because it's not managed. And also sometimes they get to the hospital and the hospitals are packed and they don't get seen in time, and they do end up dying in the hospital, or something happens to their baby and their baby dies. So it's just like, it's not really a pretty situation. It's kind of like really hard knowing like you might have a good pregnancy, but because you are not being seen every week or every month, they miss them. The capacity to care for women, I feel like the hospitals don't have as many medical help that they need, and the hospitals are packed. It's just hard for them to keep up with the rate, which brought me back to thinking of Heartline. We're small, but I would say our midwife and nurse ratio to patient is pretty good. Like we know every single one of our 70 to 75 patients here, and they know us. They know us by name. So if we see them in the street, we know, okay, this is so-and-so. Or it's just like, this is, everyone knows that so-and-so has this problem. So the instant they get here, you already have in mind, like, okay, this is a patient with a blood pressure. She's on this amount of medication. Here's the intervention. It's just like, just all in here, because we talk about our patients and we try to make sure that we get really familiar with them. That's why when they start in our program, we start with them early on in the first trimester. We don't try to do second or third trimester because we don't have enough time to get to know them. So we really want them to get to know us, and we really want to get to know them and really follow them and make sure like any prevention that we can do for them to have a safe delivery and safe healthcare, all of that, whatever we can do, we do that, and we start pretty early on.
What are some things that stick out to you that donors should know about their support of this work? What is it doing?
They're doing an amazing thing by just investing whatever penny they have or their prayers, because Heartline Maternity Center is providing jobs for midwives. And we have a lot, just the way Haiti's crazy, does not have a lot of healthcare, but we do have a lot of nurses who have a degree but can't find jobs. Mm-hmm. It's crazy. But so it's just like providing jobs for midwives here, providing jobs for other helps, the women who wash, the ones who cook, it's just who cleans. It's just like providing these small jobs. We do have a small staff, but they know that they have a stable income that comes every month. So providing jobs like this, and also providing a safe environment for moms to have their baby. We have a beautiful laboring room, birth room, where they can have their baby and be comfortable. And we have privacy where we could do 2 other rooms where we do prenatal care, where we can close the door. It's just the midwives and the patient. And then we have postpartum where we have like 4 beds, and mom can like be there for however many days that they need to be there to bond with their baby. There's no hurry for us to kick them out. And it's just like they get to have clean water. They get to have a safe environment, and it's just like being taken care and being pampered a little bit, you know, mm-hmm. Just helping them to just be here and relax. And they call each other's neighbors whenever they're in postpartum. They enjoy being like in the same room with each other watching. And that's another thing. You get to watch these moms come for 4 to 6 months postpartum, and they're like, oh, your baby has gained weight. They interact so much. So it's just like providing a nice place with security where they can come once a week or twice a week and feel like they're being loved and being cared for. And knowing that we care for their babies. Like if their baby is losing weight, we'll do whatever we can to help them. So it's just like stuff like that. It's just like whatever, all the donation that we're getting allows us to provide jobs, and also allows us to provide great care, great health care.
What are your hopes and dreams for Haiti long-term as it relates to what you do in maternal health care? And
I see a future where like we have better health care in Haiti, and where we have more maternity centers like Heartline, where women feel cared for, and just like they know they don't have to worry about having to have thousands of dollars for a C-section if they need a C-section, or thousands of dollars to pay a private doctor. It's just like I'm hoping like we get to a point where, hey, like especially for when it comes to maternal health, that women can get great care, and just like places will keep modeling this model that we have here, where they could keep providing. Like Heartline, we don't necessarily need to have another Heartline in Port-au-Prince, but we need places that can model what Heartline have here, you know? So it can, if we end up having, let's say, 3 maternity centers in Haiti, not in Haiti, in Port-au-Prince, like we do at Heartline, with the 70 people that we see 210 women that are getting great healthcare. And now imagine if you keep going like this with every you move on to Port-au-Paix, you move on to Cape Haitian, you move on to Jacmel, and it keeps growing and growing, we will play a big part in decreasing maternal health and infant mortality.
And, you know, and with the starting place model and obviously the Temple starting place, but also, you know, a lot of folks don't understand that the starting place is not only a physical location in Temple, Texas, but also a curriculum, which was built on the exact thing that you're mentioning, which is to take this model and teach others to do it, not only in Haiti, but all over the world.
Yeah.
And so, yes, I think that we are all hopeful that we can see, when you see something working and successful and holistic, and obviously with over, I think we're up to around 1,200 babies here in 2022, probably plus. You want to see that continue to grow and even exponentially grow because of its success. And I'm with you all the way. Well, that brings us to a close. I can't tell you, I am so grateful, not only for you and what you do and for the midwives and the team there, but for your time today, for your passion for what you do, for giving all these folks who are going to see this video a picture of Heartline and the human caregivers behind it. So I hope you have a great day, and thanks for joining us.
My pleasure. Thank you for having me.